Hi, I'm Carolyn. I'll be your nurse today. How are you?
I'm good.
Good. Can I get your name and date of birth, please?
Tabitha Sheets, June 28th, 1982.
Okay, thank you. I'm going to wash my hands, put my gloves on, and then I'm going to give us some privacy. Okay, do you know why you're here today?
To get a physical assessment.
Okay. Yeah, the doctor has ordered an assessment for you. Do you know what year it is?
2025.
And do you know where you're at and why you're here?
I'm at Middle Georgia College for physical assessment.
Okay. And you know who the president is?
Trump.
Okay. Um, so I'm going to start with your physical assessment. First, I want to start with your head. Do you mind if I touch your hair?
Sure.
Okay. Okay. No sign of dandruff, no sign of dry skin. I didn't see any lesions or sores. Do you have any problems with dry skin on your scalp?
Yeah, sometimes I have dandruff.
Okay. All right. I'm gonna also assess your ears. Let me get my light. I just want to look in your ear. Okay, I don't see any sign of extra earwax in that ear. No sign of earwax or cerumen in that ear as well. Let me take a look at your eyes. I see you do wear glasses. Okay, all right. I'm just going to shine this light in your eye, okay?
Okay.
Okay, so your pupils did react to the light. That one did as well, so bilaterally your pupils are reacting. So we call that perla when your pupils are reactive, active, reactive to the light. Okay? I'm also going to do a test. I want you to just look straight at the wall, and I'm going to put the pen in front of your face, and I want you to look at the pen, then I want you to look at the wall. Okay? Okay, so your eyes did accommodate to the pen. So when you looked at the pen, it restricted. When you looked at the wall, it contracted. Okay. All right. So what I want to do now is just kind of look at your face. Your face is symmetrical. Both eyes are symmetrical. Your nose is midline of your face. Can I see your mouth? Can you open your mouth? Okay, I do see that your mucosa is pinkish and moist. Okay, your nostrils are pinkish as well. The mucosa is pinkish. Can you do like touch your nose and kind of breathe in? Let me see your patency. Okay, so your patency is good. Did you have a problem breathing out of one nose, nostril? Okay. All right. I want to touch your neck. Your trachea is midline. Can you turn your head over to the right and the left? Okay, so you do have range of motion in your neck. And let me see if I don't see any jugular distension on the other side. Can you turn your head over to that side? And the bed is up at a 45-degree angle. I don't see any jugular distension on that neck as well. I'm going to touch your skin and see if there's any skin tugger. And the skin tugger reacts, recoils. What I want to do now is capillary refill. Capillary refill is less than 2 seconds, less than 3 seconds. And I want to just see if you have any edema or swelling in your upper extremity. I don't feel any edema on that arm. No edema or swelling. While I'm doing it, I want to also just kind of feel your pulses, because I did do the carotid pulse. Let me see if your radial pulses are bilaterally 2+. Brachial pulse bilaterally 2+. Femoral pulse bilaterally 2+. Popliteal pulse, bilaterally 2 plus. Dorsal tibia pulse is bilateral 2 plus, and pedis pulse is bilateral 2 plus. Okay. All right, so what I want to do now is, give me one moment, I want to grab my stick. All right, I want to listen to your lung sounds. And I'm going to start in the front. I just want to do your upper right lobe, upper left lobe, lower left lobe, lower right lobe. Lung sounds were clear. If you can lift up and let me listen to the back lung sounds.
This is the
Posterior lung sounds are clear in all lobes. Lateral lung sounds are clear in both lobes. Okay, what I want to do now is, do you have any history of lung heart disease or lung disease?
I have asthma.
Okay. What do you do to help with that?
It's usually okay unless I exercise. I have a rescue inhaler.
Okay. And now we do have something called an incentive spirometer. And what you do is the doctor's going to order you to, he'll give you a number that he wants you to do about 10 times every day, 10 times an hour. And you're going to just breathe in it to, like, make your lungs expand. Okay? And that'll help you with your breathing. And then he's also going to tell you to cough and, and rotate your body in the bed. That'll help you with your breathing and your lungs. Okay? All right. What I want to do now is just check your cardiac. Apical pulse. Pulmonary pulse. Erb's point. Tricuspid. And a mitral valve. And a mitral valve is where I would also check the apical pulse for 60 seconds. I'm going to also listen to your lung sounds with the bell. And I want to just make sure I'm not hearing any swishing sounds, because that would indicate an aneurysm. And then I'm also going to just listen to all the other lung sounds with the bell. Okay. All right. What I would like to do now is your musculoskeletal. So if you can come to the edge of the bed. You know what? Before I do that, can you lay back down? What we want to do is your abdominal. Alright, so I'm going to just assess it first, and I don't see any signs. Your stomach is round, and I'm going to just check now for any bowel sounds. And I'll start with the right lower, right upper, left lower. I didn't hear any, the sounds were active, just normal active bowel sounds. Now what I want to do is just palpate the area. Do you mind if I touch your stomach? Do you feel any tenderness or any pain? Okay, all right. I'm just going to palpate it to see if I feel any tenderness. And I don't feel any, just normal. Okay. Do you have any, do you know when the last time you used the bathroom for number 2?
This morning.
Okay. And do you know the last time that you urinated?
About 20 minutes ago.
Okay. And what was the color?
Yellow.
Okay. have any trouble urinating?
No.
Okay. Do you have any trouble defecating?
No.
Okay. And what was the color in the form of that one?
When it was formed, didn't feel mushy or loose when it came out. I didn't really look at it.
Okay. So you didn't notice the color? Or
No,
anything?
I didn't
Okay.
observe the color.
Got it. Okay. Got it. So now that we've done that, do you have any tingling for your neurological? Do you have any tingling in your feet or hands?
No.
Okay, all right. So I did assess the capillary refill and I did test your edema. I want to also just feel your temperature to make sure you don't have, if you're not too hot or too cold. But you feel normal and dry. Okay, and then I'll do the feet as well. And they're equal bilaterally. The arms are also, the upper extremities were also equal and bilaterally. So now if you can turn, put down your feet off the bed, we're going to do the range of motion on the musculoskeletal. So let's do a flex. Let's flex your arm and extend it. Okay. And then I'm going to do it with resistance. Flex, extend. Okay. Flex, extend. Okay, with resistance. Okay. And then we're going to do your lower extremities, if you can flex and extend. Okay. With resistance. Okay. Okay. Up there. Flex, extend. With resistance. Okay, great. So she has a normal range of motion. What I want to do now is just have you do the Rumberg test. If you can stand up, please. I'm going to test your balance. Okay. And close your eyes. All right. Are you feeling dizzy? Okay, good. You can sit back down. All right. If you can put your shoes on now, do you have any trouble with your gait? Do you have any walking devices?
No, ma'am.
Okay, so what I want you to do is just walk, like balance. Show me that you can balance by just putting one foot in front of the other. And just look straight at the wall. Okay, come back. Maybe a little bit. Balance, you lost your balance a little bit. Have you been experiencing that lately?
No.
Okay, well we might have to take a look at that, okay?
Okay.
All right, walk on your tiptoe. Okay, and then walk back on your heel. Okay, looks like your gait is fine that way. You just like have a little balance issue. Okay. What I want to do now is just do a little teaching. We have a scale that we do, a Glasgow Coma scale, and that just lets us know whether you're alert and attentive. So it kind of tests the eye, whether your eye open to responses, whether you're conscious, whether you're alert, and then we also have a scale called the Braden scale. The Braden scale tests whether you are at risk for skin breakdown. And so we test whether you have proper nutrition, whether you are moist and dry in the bed, whether you don't have a problem with incontinence. We also have the Morse-Ball scale, and the Morse-Ball scale tests if you're at risk for falls. And you say you don't have any walking devices, and you seem like your balance is good, so I don't see any problems with the fall. A 3 is for the Glasgow Coma scale is normally for people that are unconscious. A 2 is for normal patients. Okay, so. Let me just take a look at my paper and just make sure that I got everything.
That's terrible. You know, people dislike this too. Some do like thumbs down. Yeah, I mean, dang, you got 1.5. I know. My granddaddy only got 167 views. My meter.
Is that everything? So the doctor will be right with you. Thank you.